Hi, my name is Dr. Juhi Jain, and this is Socha from the University of Miami Miller School of Medicine. We are here today to talk about a very important issue, human trafficking and the role of the medical professional. This work was funded by a grant from Adrian Arsh and the University of Miami Ethics Department Arsh Initiative. What is human trafficking? Human trafficking is the recruitment, harboring, transportation, provision, or obtaining of a person through the use of force, fraud, or coercion for the purpose of subjectation to involuntary servitude, which is a form of modern-day slavery. There are two types of trafficking. There's sex trafficking and labor trafficking, and there are many people that are in both forms of trafficking. Labor trafficking includes agriculture, hospitality industry, tourism industry, hotels, and bar services. The extent of the problem globally, how many slaves are there worldwide? There are 20 to 30 million slaves worldwide. Again, 20 to 30 million slaves. It is second only to the illegal arms and drug business. It's a $32 billion industry with 15.5 of that coming from industrialized nations such as the United States. The sexual exploitation industry is 80% female, with 50% of them being children. The average price of a slave now is $90, whereas in 1809 it was $40,000. As you can see, the value of a human life has degraded over the years. So what about the commercial sexual exploitation of children? So as I said, 50% of those in the sexual exploitation industry are children. About 1 million children worldwide are part of this industry. The majority are girls. They're violated by sexual acts 100 to 1,500 times a year.
It's important to remember that while this is an international problem, it's not a foreign problem. Each year, between 17 and 20,000 women, men, boys, and girls are trafficked into the United States from international settings. And an even larger burden, which is often overlooked, is that between 100 and 300,000 minors, girls and boys, will become victims of sex and labor trafficking every single year. Who these victims are, we'll go into detail a little bit later on, but about 300,000 Americans are at risk. Many of them are runaways or youth that are thrown out of their homes, and they often come from abusive homes. Additionally, the average age at which these children will enter into prostitution is between 12 and 14 years old. The United States has established a national human trafficking hotline to combat this evil and is currently ran by the Polaris Project. In 2013, the Polaris Project received 30,000 phone calls providing them with tips about potential victims of human trafficking. And in 2014, this number decreased to only 20,000 phone calls. Now, this is a good step in the right direction, but these numbers pale in comparison to the number of people that are actually victims each year. Here's a map of the United States, and we see that this problem is diffuse. It's spread throughout the United States in areas all across the country, and we see that major cities are often the hub of human trafficking. Miami ranks in the top 3 cities with victims of human trafficking each year. So now we're going to be talking about identifying victims. What are the signs and symptoms that you can see to recognize someone that may be a potential victim of human trafficking? One common myth is that if a person originally consents to their sex act or to participating in this form of labor, then it is not considered human trafficking. However, the truth is that you cannot consent to human trafficking. If acts of fraud, if acts of force or coercion of any form is involved, even if the victim receives a payment, it is still a crime and it is still trafficking. Additionally, if the victim is a minor, any commercial sexual acts are considered a crime against that minor. So the challenge is, how do we identify these victims? How do we recognize these victims? Now, as medical professionals, we will see a lot of victims come through our emergency departments and our clinics and may be completely unaware that they are victims. For us, law enforcement officials are a common initial point of contact for a lot of our victims that we will be seeing, as they have already been rescued out of their situation. However, studies show that 28% of trafficking survivors have seen a medical professional at some point in time during their captivity. Now, this is just the number of survivors, which means that Many more people who are still victims have seen a medical professional, interacted with a medical professional, and gone unrecognized. So we're going to highlight the major signs and symptoms that can clue you in on whether or not somebody is a potential victim of human trafficking.
So who is a victim? What is the face of a human trafficking victim? A victim can be from any background or ethnicity. It can be citizens, illegal immigrants, or people without legal immigration status. How do you identify a victim? So a patient comes into your ER, a patient comes into your clinic. What are the signs that this patient might be a victim of human trafficking? One important sign is whether they have any identifying documentation. If they have none, that's a clue in is why don't they have an ID? Why don't they have a passport? Why don't they have something to identify who they are? Also, vague answers about their situations or inconsistencies in their stories. One of the signs of trauma is that they're not able to tell a coherent story. They don't remember what happened today, from yesterday, from a week ago. You know, a patient should be able to tell you what happened. So if their stories seem inconsistent, they're not really able to tell you where they live or what their job is, really think about them being a victim of human trafficking. Also, no eye contact. If they look down, if they look to the side, anywhere but at you, that could be a sign that they're being forced to do something or that they're not allowed to make eye contact. If there's someone that comes in with them and they're very overbearing, they won't answer the question, they won't let the patient talk, they answer the questions for the patient, that's a sign as well. And make sure, it's very important that you separate the patient from anyone that's come in with them while you're doing an interview. Also, if they have no control of their money, if they look malnourished, look at the patient as a whole. Do they look malnourished? Are there signs of abuse? Are there old scars? Do they have broken ribs? Look at their medical history. Have they come in multiple times to your clinic or the ER? Do they have multiple sexually transmitted diseases? Do they have multiple fractures, multiple scars or bruising? Those are all going to be signs that make you want to think of a human trafficking case. Signs of physical abuse, signs of depression, PTSD, those are all going to be important. Substance abuse is a big one because a lot of traffickers use drugs to subdue the victims and make them do the work. If they look younger than 18, younger than their stated age, if they have inappropriate attire for a healthcare visit, whether that be anywhere from lingerie to really expensive clothing, ask them where they got this clothing from, how are they able to afford it. That can clue you in as well. Like we said, multiple sexual partners, multiple STIs. Tattoos and branding are a huge sign. For every patient that comes in, make sure you look at their tattoos, look at what it says. Ask them, is there a name of their pimp on there? Is there a number? Is there a barcode? And look in places that you usually don't think about tattoos being. We've had victims come in with tattoos on their eyelid, inside their mouth, inside the vaginal wall, inside the inner thigh, under their arms. So really look at the patient as a whole and ask what these tattoos say. And also another important thing is previous history of sexual abuse or trauma. Over 90% of the victims have a history of sexual abuse in their childhood. So that's going to be a very important fact as well. So one of the important questionnaires that we use is the U.S. Department of Health and Human Services questionnaire. So it's important to screen for these victims. One of the main important points is that a lot of these victims won't self-identify as a victim. So they won't come up to you and be like, I'm a victim of human trafficking, please help me. A lot of them are reluctant to say this. So it's really important that we ask the questions. A lot of the victims in studies that have been done have said they were asked by a healthcare professional, they would have disclosed their situation. And another thing is that I urge you to take 2 to 3 of these questions and put it into your social history that you ask every patient. Make it a regular routine so that way you will not miss a victim of human trafficking when they come into the ER or your clinic. So the questions are, can you leave your work situation if you like? When you're not working, can you come and go as you please? These are freedoms we naturally have as human beings, but victims of human trafficking cannot do these things. Have you been threatened with harm if you try to quit your job? Has anyone threatened you or your family? How many consensual and non-consensual sexual partners have you had? This is a very, very important question because it takes away the judgment from the victim. Non-consensual partner implies that this was an unconsented act, and this is a very important point in giving validity to the patient's situation. What are your working or living conditions like? Where do you sleep and eat? Do you have to ask permission to go to the bathroom, to sleep, or to leave your place? And is there a lock on your door or window? So what do you do once you identify a victim of human trafficking? So the main point of contact is going to be the National Human Trafficking Resource Hotline, which is run by Polaris Project. The number is 888 37 37 888. Again, 888 37 37 888. As soon as you identify a victim, this is the number you should call. They will lead you step by step of the actions that need to be done. If the patient is a minor, you are obligated to report this crime. If a patient is not a minor, then you need to discuss with the patient if they feel it is safe to leave their situation. If they feel that it is, you will call this number and get them help. Polaris will contact the local human trafficking task force, which is law enforcement, who is trained in dealing with human trafficking victims. And if they do not feel like it is safe, you give them all the information that they need to be able to get out of the situation. So now we're going to go into the medical needs of victims.
So we will now be talking about the medical needs of trafficked victims. And it's important to remember when we are screening these patients and interviewing these patients that they are survivors and they have experienced a lot of trauma. Some of the things that we're going to look for are a history of multiple pregnancies, potentially unwanted pregnancies, and with that, unsafe or forced abortions. And as a result, they may have many signs and symptoms of this form of trauma. Additionally, there are high prevalence of sexually transmitted infections within this population that need to be screened for and treated. They are also at risk of developing many communicable diseases, such as tuberculosis, and experiencing physical injuries, starvation, nutritional deficits. We need to look at the overall picture of their health. Okay, the last 3 points on this list are very important. The first one, drug addiction. Many of these women have a background of experiencing drug addictions as a result of drugs used by the pimp to influence them and to keep them addicted, keep them coming back, and to numb the pain while they're performing their services. So you must take your time with these patients and be understanding of this history. Additionally, a lot of them have experienced psychological trauma and may have symptoms of post-traumatic stress disorder. And they may have underlying psychiatric disorders such as bipolar disorder and depression that all need to be screened for and treated in these populations. Immigrants that are brought here from overseas may have vaccination histories that haven't been updated, and they may require screening for these diseases or additional vaccines. Sexually transmitted infections. Rates in this population, as you would expect, are higher than our normal rates. We see high rates of syphilis. As many as 1 in 5 of these women may have syphilis. And in a research study, we saw that 15 brothels, when examined, had rates of HIV infections as high as 60 to 80%. Now, these are alarming numbers. And with this HIV infection, we see the spread of mutated disease. We see co-infection with other sexually transmitted infections. So this problem is becoming a larger public health problem as there's an additional development of resistant strands of disease. The most common presenting health symptoms in these women and men are health symptoms that you would often see a patient present for. We see things like headaches, dizzy spells, back pain, fatigue, memory problems. These patients look a lot like normal men and women when they present, although many will also have sexual health problems from pelvic pain, gynecological infections, vaginal discharge. So it's important to screen for everything and treat for everything in this population.
So another common complaint is going to be chronic pelvic pain. Studies have shown that reported pain of chronic pelvic pain is out of proportion to the actual physical manifestation of disease. This includes endometriosis, pelvic congestion, or adhesions. So for a lot of women, this is actually more of a psychological or psychiatric problem because pain occurs where the trauma occurred. And the pelvic region is actually associated with female sexuality and identity. So this is going to be a chronic problem that will need to be addressed over multiple visits. Also, we have to think about mental health problems, depression, PTSD, suicidal ideation. These are all important to screen for during a medical interview with these patients. There was a Zimmerman study that showed that 50% of victims, after coming out of a trafficking situation within 2 weeks, presented with 12 to 23 medical health problems. That's a lot of medical problems for one person. But the beauty of this study that showed that there's a substantial symptom reduction with a healthcare professional after 3 months. So if we provide these victims with proper care, we can actually reduce their symptom burden and reduce the number of symptoms that these women had. The one symptom that we were not able to reduce within 90 days was depression, and that would be something that would need to be held with ongoing care.
We're now going to be discussing a trauma-informed approach to interviewing these women and men. It's important to remember that these people have experienced an extensive traumatic history, and that we need to be patient in these interviews, that we need to lay aside some of our assumptions about psychiatric disorders, about drug addictions, and take your time and really relate to them as people. Healing can begin during the exam, and it's all about our compassion with them and relating with them. When interviewing these patients, it's important that you explain everything to the patients, that you explain the purpose of the interview, that you ask them for permission before you engage in the exam and before you question them about more sensitive topics. You must explain the confidentiality to them. A lot of them may have issues with trusting people in the past and may be hesitant to disclose information at the beginning. So you need to establish a relationship of trust and inform that everything will remain confidential. Additionally, when you're interviewing these patients, recognize their strengths, talk to them about their strengths, and build upon that. Show them that they have autonomy in this interview. Show them that they are in control. When interviewing these patients, the interview may go completely normal, or they may experience some of the symptoms of post-traumatic stress disorder from their history of trauma. Some of these symptoms include re-experiencing some of the trauma from the past. They may have flashbacks. They may get nightmares. They may have intrusive images. They may also show avoidance behaviors. They may have a flattened affect. They may be reluctant to disclose some of the answers to some of your questions. Conversely, they may have autonomic hyperarousal. They may be in an excited state and have an exaggerated stutter response. So when interviewing a patient with a trauma-informed approach, if they experience any of these symptoms of PTSD, take time to stop the interview, to look at them as your patient and show compassion at them as a fellow human being, and allow them to walk through the symptom. Speak to them about what's going on. Make sure you change the focus from victimization to survivor. We want to treat these patients as survivors, not as victims anymore. They've been through a lot. It's time for you to help them push forward, help them with the healing process. One exercise that can help if the patient does start experiencing symptoms of post-traumatic stress disorder are breathing exercises. You can help them slow their breathing, focus on their breathing, and know that they are in a safe environment. It is important to build trust with these patients, to make sure that they know that they can rely on you, to put that history of distrust behind them and move forward, engaging the medical profession and trusting in medical professionals. If the patient doesn't feel comfortable answering a question, that's okay. Move on and go on to the next subject. So now we're going to talk about the steps of the medical exam.
Okay, so what do you do once you have a patient, you know that they're a trafficking victim and have to do a medical assessment on them? So one of the important things is going to be to assess and treat acute and chronic medical conditions. Determine if the patient needs to go to the ER. Is this something that needs to be done in the hospital, or is this something that can be done in your clinic? Remember that the medical document is a legal document, so everything needs to be documented, documenting all the injuries, whether they're acute, remote, genital injuries, cutaneous or oral injuries, closed head and neck injuries, thoracoabdominal injuries. Remember, a lot of these injuries can be internal as well, and skeletal fractures. So it is important to remember that this patient population has a unique set of trauma-induced injuries. It is not important for us to know why or how these injuries occurred. What is important to know is the nature of these injuries. Was it a strangulation injury? Did they ever lose consciousness? Was there concussion? Did they have gunshot wounds, stabbing, rape, bruising, or lacerations? It's just important to know where on the body and what kind of injury it was, but we do not need to put these patients through any more trauma than they've endured already. So for the medical exam, we also have to assess their overall health status. So especially for labor trafficking victims, we want to really assess their nutrition. A lot of these victims are working 12 to 24 hours a day and are not fed, they're not hydrated, they might have a lot of mineral deficiencies. So we really need to look at their iron levels, mineral and vitamin levels, as well as their hydration status. You need to assess for mental health issues. As we said, it's a big component. of being trafficked. So screening for depression, bipolar disorder, PTSD, all of that, drug and substance abuse, all of that's going to be very, very important. Testing for pregnancy, STIs, and HIV is also going to be very important, especially for those who have been sexually trafficked. Urine or serum screening for alcohol and drug use, as I said, is clinically indicated. We also want to be able to offer contraceptive options, especially for our sexually trafficked victims, especially long-acting and reversible contraception, as well as offering prophylaxis for STIs and pregnancy. So human trafficking is a human rights violation. It is happening here in America, and we as a medical profession are at the front lines of it. We are able to help these victims. I urge you to please close your eyes and take every child as your own daughter. Then you will feel the sorrow, and then you will feel the strength that comes out of you to protect them. Thank you for watching this video, and we hope that you're better informed of how to identify victims and to take care of their medical needs.